Well, I want to thank Chairman Reichert for holding this hearing today to discuss how social impact bonds can be an innovative tool to improve social and public health outcomes, save taxpayer resources, and unleash non-governmental investment capital to help at-risk Americans. I also want to thank our panelists for being here today to share your testimony with the committee. I want to give special recognition to Congressman Delaney, a Maryland Democrat, and a very conscientious colleague, for his leadership and partnership with me on this initiative. This is the sort of big idea, bipartisan initiative that we need more of in Washington, and he's helped make that happen here. Now, I've studied a bit of economics at the University of Chicago, and I want to start today with a quote from Milton Friedman, who once said, "One of the great mistakes is to judge policies and programs by their intentions rather than their results." I've spent the last 2 years on this subcommittee learning about many of our nation's social services programs, and I found that to ring exceedingly true. For all our best intentions, each of us knows that too often we see government programs fail the constituencies they're intended to help and the taxpayers who fund them. Unfortunately, instead of trying to determine how to get better results, serious discussions about social service provisions tend to devolve quickly into superficial arguments over funding levels. Instead of outcomes, we spend too much time talking about inputs. Now, to some, it's tempting to measure compassion with dollar signs, but this was not and is not what our social safety net is all about. Social impact bonds can help change our focus from inputs to outcomes where it belongs. They do this by requiring every approved project to answer 3 basic questions at the outset. 1, what does a successful outcome look like? 2, whom are we trying to serve? And 3, what is the value of a successful outcome in terms of current government spending? When those questions are answered, we can develop programs with measurable policy goals and measurable savings. Measurable policy goals and savings are preconditions to using social impact bonds as a funding mechanism to raise private investment capital, administer the evidence-based social intervention, and then if, and only if, those policy goals are met, the federal government can pay back those initial investors. If the goals aren't met, the federal government doesn't owe a dime. In essence, SIBs bring pay for performance to the social and public health sectors, allowing the federal government to improve both the impact and cost effectiveness of vital government services. In short, the Social Impact Bond Act, which I sponsored with Congressman Delaney, as well as Mr. Griffin and Mr. Reed on this subcommittee, and several Democrats, including Mr. Larson, who is joining us here today, empowers states, local governments, nonprofits, and the private sector to scale up evidence-based social and public health interventions to address some of our nation's most pressing social challenges. The results of these projects will help empower well-intentioned policymakers across all levels of government to improve lives through evidence-based policymaking, as well as aid nonprofits in expanding their models with fidelity across different geographies and populations. In turn, this expands our menu of policy options and offers meaningful alternatives to simply increasing funding for existing government programs that we know are less than successful at meeting their stated policy objectives. With that, I'll once again thank our panelists for being here today, thank the chairman for this opportunity, and I yield back.